Many residents in the Bay Area suffer from macular degeneration, but many of us are still kind of unclear on what the disease is. Well, Dr. David Garuda joins us to explain that and Newsom Eyes' amazing outcomes and how they provide Newsom Eyes. Good morning, Doctor. Glad to have you here.
Thank you for having me.
So kind of explain, if you will, what this is. I feel like I've heard this over the years, but really describe what it is.
Well, macular degeneration is a term you may have heard, but a lot of people don't know what it is. It's a disease of aging that affects central vision. The retina, which is like the film in a camera, when cameras had film, starts to degenerate as we age. And in some people, it does at an accelerated rate to the point where they start to lose their central vision.
So when you say central vision, because normally you're hearing near side, I mean, what is kind of the, can you tell if it's actually macular degeneration?
Well, we can tell,
yeah,
of course, but the patient may not be able to tell. All they know is that their vision is
Does
not...
it start to get blurry? Does it start to...
Exactly.
Okay.
Things can get blurry. They can have trouble reading. Things that were, that are straight start to look curvy. So those are very typical symptoms.
Okay, affect your vision. Is there anything we can do to prevent this?
Well, unfortunately, genetics plays a big role in this. So you can't choose your parents.
Okay.
However, lifestyle factors are at play here. The biggest one being smoking. So don't smoke.
Okay.
Don't start if you haven't started. For a number of reasons. Keep control of your blood pressure, your cholesterol. Try and avoid gaining too much weight. It creates diabetes, which can create another eye problem, but also contributes to macular degeneration.
Oh, wow. Talk about treatment options. Are there any treatment options? What can you do if you were starting to get this? I'd imagine early detection is key.
It is key. And yes, there are treatment options. Unfortunately, macular degeneration cannot be cured, but it can be treated, and many patients can maintain their vision for the rest of their lives with proper treatment. There are two types of macular degeneration. A dry type that is treated with vitamins primarily and lifestyle changes. Okay. And then there's a wet type that in the last 15 years has undergone revolutionary improvements in treatment that involve medicines, in some cases lasers, that can preserve people's eyesight well into their late life.
I mentioned testing. How soon do you start kind of testing for this, and if people are going to be kind of susceptible of this? Certainly, I'd imagine, too, if you know that your parents had this or it is, running in your family.
Well, I think if you have it in your family, that you should probably be examined in your 50s for the disease. However, the disease typically affects people 60 and older, and with increased prevalence as we age.
Any other kind of commonly asked questions when it comes to this that maybe we haven't addressed yet? I mean, again, I'd imagine this is a very common issue that you see into your office.
Unfortunately, it's very common. We have an aging population. Here in the Tampa Bay area, we have a lot of retirees. I would say that it's important in your 60s, if you haven't had an eye exam, to get one. There are a number of different diseases besides macular degeneration that affect people in later life, typically 60s and beyond. So a full eye exam as you reach your 60s or retirement age can catch a lot of problems before they become a problem that it's going to affect your eyesight.
Well, Doctor, thank you so much for coming in today. I learned a lot. We appreciate your time. We look forward to when you and your team are back.
It's really been a pleasure. Thank you.
All right. Well, to make an appointment with Dr. Garuda, or if you have any additional needs for eye contact, contact Newsom Eye at the number and website on your screen right there.